founder of the Environmental Justice and Health Alliance for Chemical Policy Reform. And again, I want to thank you for this opportunity to share with you. You know, I just want to piggyback on something earlier today. I was not trying to be facetious about my sinus. It's, you know, this is something that many communities who live fence-line to these industries experience in disproportionate impacts, and that's asthma, cancers, heart disease, and the likes. So all of that to say, in the event of, and with respect to working in communities across the country, at times I serve communities who are in harm's way to natural as well as these chemical disasters, such as the Gulf Coast, as well as along the Northeast Corridor. When these folks are told to shelter in place, there's no way in which to get the medicines and the assistance that they need in order to help them through these disasters. And oftentimes it can exacerbate severe asthma attack and the likes. All that to say, we need a deeper source of training and interconnection between local, federal, and state governments so that we are, number one, not only mindful of where these harmful chemicals are stored, but also mindful of where the high populations of serious health challenges are. All that to say, that should be the direct reason for, sorry, that should all the more reason be why we should make sure that where indeed possible and proven, safe alternative chemical substitution can be made, number one. Number two, minimizing the storage of these facilities, these chemicals in bulk storage and use as needed, number two. Number three, also, this is also stimulating the market, if you will, to become more innovative, opening up those doors to be able to go deeper into the R&D and be able to produce the safer alternatives necessary to better protect all people in this country and beyond, right? And in doing so, as we're addressing the issues of economics right now, as you've heard from some of the chemical corporations who may be challenged, I truly do believe, and many of the communities that I've served truly do believe that this will bring the innovation necessary that's needed and even more jobs. And more healthy jobs, I should say, because at the end of the day, we are about protecting the public health of workers and communities. And again, if I can continue to reinsert my former role as an environmental scientist working in a local community, the day that I was called personally to go and respond to the standard chlorine leak in Delaware City, I will be honest, I had not had any training that year, where we go through a series of ongoing repetitive trainings, right? It's calendared for when you do these things. That particular year, I had not gone through anything, so I'm in my truck on my way to a facility to do yet an inspection to respond as it relates to the NIPDIS, the National Pollutant. It eliminates discharge, I'm sorry, all these. Anyway, in response to that, I get an emergency call to go down Route 9 to standard chlorine, to go into a chlorine cloud leak that, number one, I didn't have all the necessary materials in my truck to respond to. Number two, I had not had the training, or at least a refresher training. So I say all that to say local governments need to have, there needs to be some type of training for local government responders, such as a person like myself at that particular time, where I worked for Newcastle County Environmental Laboratories. which was part of Newcastle County Division of Public Works. Not only that, many health professionals are not trained to really put those processes together as far as it relates to toxic chemicals and human health. In some cases, those are elective courses in various schools. So all of that to say, there has to be some type of program in place that should be, I think, run through, I don't know whether it's run through the Department of Health and Human Services, along with a piece that OSHA and EPA addresses in order to make sure that everyone across the board is trained to for response, as well as the fact that we must make sure that there is some plan in place for communities such as the community of Mossville when it is necessary for them to evacuate or to shelter in place. There's a process to respond after that. There was a there was a fire in a home, in a Mossville home, that was not adequately responded to. And that was back in, I want to say, 2009. And ever since that time, the Mossville community appealed to the local LAPC. They wanted to have a meeting with the community to talk about ways in which to respond. Unfortunately,